It's time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and Paul J.
Morning, Doc. Ideal weight gain for a woman. I know that difference in sizes, whatever, a lot of circumstance. What's the ideal weight gain for a woman during pregnancy? Is there one?
Well, Paul J., you're right. It does depend on a few things, including the pre-pregnancy body mass index and the size of the baby. But there are current guidelines. These are from the Institute of Medicine, and they do recommend different weight gain ranges for pregnant women, which could be anywhere from 10 to 40 pounds, depending upon their body mass index.
Now, do most expectant mothers gain weight within that range?
Chris, most do not. In fact, the vast majority of pregnant women fail to gain weight as recommended. In fact, about 70% of pregnant women fail to gain either more or less. Actually, they gain more or less than what is recommended.
Risks. What kind of risks are involved with gaining too much and or too little weight?
Paul J., if you gain too much weight when pregnant, that's associated with a higher likelihood of having an infant that's larger than usual and a higher chance of delivery by cesarean section. Gaining too little is also not good. That's associated with a higher likelihood of having an infant that's smaller than normal and also with a higher chance of having a preterm birth.
Doctor, we hear about opioids and the opioid epidemic a lot now.
Proper nutrition doesn't just affect how...
Let me turn that off. Well, the FDA, the Food and Drug Administration, have said that they want a powerful prescription opioid pulled from the market. Can you tell us about that?
Yeah, this is an unprecedented step that the Food and Drug Administration, for the first time, has asked that this powerful opioid pain medication be actually pulled from the market. And that's not, Chris, because of its lack of safety or efficacy when taken as prescribed, but rather because of its great potential for misuse.
There's been so much talk about opioid misuse. Can there become a point where the benefits of opioids are overshadowed by the mistreatment of opioids?
Well, in the case of this particular drug, Paul J., that point has been surpassed. That is, the FDA actually thought that the value of this drug was not exceeded by the great risk related to those who are abusing this medication. What they're doing is they're crushing and injecting this medication to experience this massive euphoria all at once, whereas it's really intended to be released over time, and that's why it's so potent. And so the FDA has actually concluded that they should recommend that it be removed from the market.
What is the biggest concern of the FDA?
The biggest concern is just mitigating overall the opioid epidemic. You know, Chris, in a recent year, more than 33,000 people died due to an opioid overdose.
Wow. A few days ago, Doctor, we heard this heartbreaking story. There was a 4-year-old boy in Texas, and he died as a result of drowning, but it was a week after he had gone swimming. Now, what happened there?
Yes, this unfortunate boy, he was only 4 years old. He died 1 week after he inhaled water while swimming on vacation over Memorial Day weekend. Essentially, Chris, he died because he drowned on dry land a week after he went swimming.
Wow.
How did this happen?
Well, the boy succumbed to this rare condition called dry drowning. It's a condition in which you react in a delayed way to inhaling water. And what that inhaled water does is it remains in your lungs, it obstructs the air passages so that you have a problem exchanging oxygen. And so oxygen levels over time in the blood drop, the heart slows, and eventually stops, as it did in the case of this boy.
Is there some way we can spot this? Is there something to look for?
Yeah, you know, parents should be alert. And if there's any silver lining to this cloud, it's that the parents of a 2-year-old in Colorado, a different state, were aware of this boy's case, and just recently they were able to quickly take their child to the hospital because they detected these symptoms, which include persistent coughing, shortness of breath, chest pain, fever, and unusual mood change, which appear usually about 1 to 24 hours after the incident in the water.
Well, Dr. Hiatt, thanks for your time this morning on KBOI.
Thank you.
Thanks, Doc.
The KBOI Medical Moment is brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence.